everyone. This is Dr. Jonathan Limberakis joining you for episode 3 of Doctor to Doctor. Today, I have a very special guest, Dr. Arnold Malerman, and it's a special guest because he's an orthodontist and he has many years of expertise, but it's especially amazing to have him on because this is my orthodontist and he is responsible for my smile. Of course, my dad has something to do with it, but if you want to look at this one, he's the guy responsible. And so, Dr. Malerman, I was just realizing today that you and I have known each other for 25 years.
Amazing, isn't it?
It's pretty awesome. And that's kind of the role that an orthodontist has in your life. So before I go on a tangent here, Dr. Malerman, would you introduce yourself?
My name is Arnold Malerman. I'm a 1968 graduate of Temple University School of Dentistry, member of Omicron Kappa Upsilon, which is the National Dental Honor Society. I spent 2 years doing general dentistry for Uncle Sam, went to Penn for my orthodontic training, finished there in 1972, and I joined Penn's faculty in 1973, and I'm still there. They haven't found a way to get rid of me yet.
So you have a couple years of experience, I would say.
Yeah.
That's pretty amazing. So how did you end up going from general dentistry in the military to orthodontics? How did that work out exactly?
Well, actually, general dentistry was a stepping stone to orthodontics. I was 14 when I decided I wanted to be an orthodontist, and I was fortunate enough to be able to follow my dream.
That's pretty amazing. I think that when I talk to a lot of students who are interested in going into dentistry, I'd say at least half of them initially say, oh, I want to become an orthodontist. And I think the reason for that is, for most people, the only experience they have with dentistry is just their regular GP or an orthodontist. So it kind of makes sense that 50% want to go into ortho. Can you tell me briefly, what is the role of an orthodontist?
What we do is dentofacial growth and development, orthodontic treatment, which means moving teeth, orthognathic treatment, which means moving jaws. We create a balanced face, a balanced occlusion, a balanced smile, and hopefully one that'll last for at least a week or two after the braces come off.
What do you mean by a balanced occlusion and a balanced smile?
What we follow are Andrew's 6 keys to occlusion, and if any of you want the citation, let me know. I'll be happy to send you the information. Teeth are supposed to come together in a very specific way if they are going to fit and function properly. Jaws are supposed to come together in a very specific way if they're supposed to fit and function properly. And that's our job. Our job is to make sure that we follow all of the procedures, all of the rules to create the optimum balance for each patient.
What would happen then if someone did not have a balance of their bite or of their smile or of their growth?
What you have are problems with function and with stability. Teeth don't work as well. The tissues that support the teeth are stressed. It's harder to keep your teeth clean. It's more difficult to chew. No one's ever died from a malocclusion. We're not talking about quantity of life. We're talking about quality of life. If they fit better and work better, they look better, they last longer.
Quality of life is definitely an important hot topic, and it's your confidence in your smile can truly change who you are as a person, how you feel about yourself and how others perceive you too. Whether it's right or it's wrong is a different thing altogether. But there's no doubt in saying that if your smile looks better, you feel better.
There have been studies done where they looked at people that are out of their training, whatever it happens to be, whether it's high school or college or graduate school, and they go to apply for their first job. And there are 2 people applying. The one with the better smile has a better shot. Is that fair? Not really, but that's just the way we are. That's the face that the business wants to present to their customers.
That's interesting, and not at all surprising either. And then especially if you talk about in today's world where everything is photographed and online,
Mhm.
it makes sense why uh, people are more enthusiastic about getting a nicer smile. And I
Yeah.
actually I had spoken to someone in orthodontics regarding the amount of clear aligner type of cases, and people are finding now that the amount of FaceTime we have on Zoom during meetings and all that, there's actually a drastic increase in number of people who are straightening their teeth, which is pretty interesting, I think.
That's true. There's been a huge market created for the person that didn't get orthodontic treatment as a child or a teenager, or that didn't follow up with their treatment, and now they're looking at some relapse and would like to address that. And for some people, clear aligners are a marvelous solution.
So you actually hit on something about child and teenage orthodontics. What would be the ideal age to have your child looked at for orthodontics?
The American Dental Association, the American Association of Orthodontists, and the American Academy of Pediatric Dentistry all agree that all children should see a general dentist or a pediatric dentist at eruption of their first baby tooth, but no later than their first birthday. That way, their first appointment with a dentist is easy and fun, and they're not coming in to see a dentist for their first appointment with a problem where things hurt and where difficult treatment is required. Well, the same thing exists in orthodontics. We want to see patients at eruption of their first permanent tooth, but no later than their 7th birthday. I've been fortunate enough to have spent a lot of years teaching growth and development, and I've also done a bit of writing on the subject that's been published. If we see a patient at age 7, we're not necessarily going to treat them. It all depends on what they bring to the table.
Right.
But what it does is it gives us the opportunity to begin their treatment at the appropriate time. For some children, that's 7. For others, it's the prepubertal growth spurt at about 9, 10. For others, it's just before they lose their second deciduous molars. The last thing that we want to do is wait until all the baby teeth are gone to see a patient, because when all the baby teeth are gone, we've lost space. And that can make the difference between extraction and non-extraction treatment.
Exactly. And you know, I'm actually going to throw some photos up once I edit this to show. My mom just found the pictures of me the day of I got my ortho with you. So I'll add those to the presentation.
Way back in the covered wagon carpool days.
That's right. So in terms of, there's the tooth aspect, the teeth aspect, but there's also the growth of the skeleton. When you're starting to look at the orthodontic outlook, you have a certain time frame where the sutures of the skull haven't closed up completely. So what type of time frame are we looking at to really maximize efficient and predictable orthodontics?
For most patients, that's early teens, just before the second deciduous molars are lost. That'll give us the pubertal growth spurt to work with. We can complete treatment in the shortest period of time, best possible result. And what we can do at that age in a year and a half might take us 2 years to do a couple of years later.
Right.
On the flip side of that, sometimes what we want to do is prepare a patient for braces by doing interceptive treatment. For example, the child that presents with a narrow upper jaw, maybe they sucked their thumb and pulled their upper jaw forward and it collapsed inward in the back. If we don't address that as a pre-tween, then we run the risk of the canines becoming impacted.
Is
It's
that what you
important.
would consider stage 1 orthodontics?
Yep.
Or
Mhm.
okay, so in what situation? Oh, and what percentage, if you could? I know this is a general roundabout, although
Right.
knowing you, you might have an actual number. Um, what percentage of patients would you suggest may need the interventional orthodontics early on?
Uh, Depending on the study you read, between 15 and 35%.
There you go. I knew you'd have a percentage.
Sorry about that.
No, I'm happy. I'm really happy about that. That's why I have you on. Let's switch topics very briefly. Can you talk about the importance of hygiene when you're in orthodontic treatment?
If teeth are kept clean and gum tissues are healthy, teeth move faster, you get out of braces sooner. There's less risk to the enamel of the teeth. Every orthodontist has that one patient in their practice that no matter what you did to try to motivate them, it didn't work. And when their braces came off, it was ear to ear decay.
Mm-hmm.
And sometimes we have to remove braces early. I've unfortunately had parents say to me, I have to battle with my child about doing their homework and getting up in time for school and all the other things that kids do to devil their parents. I don't want to
Not
have
me.
to argue with them. Never. I don't want to have to argue with them about their hygiene. And we see a patient once a month, once every 2 months. We make an adjustment, send the patient on their way. The patient sees themselves in a mirror every day. The parents see them every day. That's the family's part of orthodontic treatment.
Right.
Orthodontics is different than any other of the dental disciplines. In most of dentistry, treatment is episodic. You walk in, you sit down in the dentist chair, the dentist does their magic, you get up and leave, it's over, it's finished, and it looks marvelous, and everybody's happy. In orthodontics, it's continuous treatment rather than episodic treatment. And the better the patient does at following instructions, the faster their appliances come off, and the better the result's going to be.
Right. So there's a multitude of reasons why you need to keep things clean during
Okay.
ortho, because for anyone who wants to make things go faster, that's a good enough reason right there. But then also, I mean, there are plenty of times where the brackets come off and then the dentist is doing fillings underneath, or the teeth have these little boxes of yellow or white or brown around where
Right.
the brackets were. It's just not what anyone wants at the end of the day.
I have a bit of advice for the general dentist and the pediodontist. I need your help as far as the patient's hygiene is concerned. So if the patient comes into your practice, sits down in the hygienist's chair, and the hygienist does her thing, and the kid looks great, then you come in and take a look, pat the kid on the head, and send him out the door. That's not doing the kid a favor. Better if the dentist takes 30 seconds or so and takes a look at the child's hygiene level before the hygienist goes to work. Then the dentist, when the dentist comes back in to check for cavities and so forth, can talk to the patient about their hygiene and what the patient really needs to be doing to help their orthodontic treatment.
Absolutely. I make sure I always take a little bit of extra time to go over that, especially if it does need tweaking. So, actually, what would you recommend in terms of special care that someone could use when they have brackets and wires, for example? What helps them keep that clean?
It's really not that difficult. Brushing 2 full minutes twice a day, soft toothbrush, whether it's mechanical or manual, doesn't matter. The difference between the two is it's statistically noticeable, but not a great deal of difference. So what I like to ask my patients to do is to use 2 different toothbrushes, one in the morning and one in the evening, that are shaped differently. One may be an electric, one may be a hand toothbrush. but they each do something a little different, and they reach different spots. But the big thing that they have to do is they have to brush 2 full minutes by the clock. You can't get braces clean in less than 2 minutes. So in today's world, I'm suggesting that our patients take their phone with them into the bathroom and play a song. Brush one whole song. It's a lot less boring than standing there. And you may even learn a new dance step or two while you're brushing your teeth. The other thing that you have to do is you have to clean between teeth. You can only get your teeth 65% clean with a toothbrush. There's 35% you cannot reach with a toothbrush. And it's a pain in the butt to have to floss. It's effective, but it takes time, and it's, especially with braces, it's a difficult thing to do. So we recommend that each of our patients uses a water pick once a day. Fill it halfway with room temperature water. Put the tip inside your mouth, lean over the sink, and then turn it on. And let the water just drip out and run through that half container full of just plain tap water. And I found that our patients that use the water pick every day get out of braces sooner. They can knock months off of their time in treatment. They have less risk of damage to the enamel of the teeth. They have less risk of the permanent damage that's caused to the periodontium. If you have periodontal disease as an older child or a young teenager, you're going to have periodontal disease as an adult. It's the same periodontal disease. You have damaged the gingival attachment apparatus. It doesn't repair itself completely. So water pick is a marvelous thing to use. But just remember not to squirt your mom too often.
You know, you always have the best little tips like that, because I remember when I went to ortho, you told me with my rubber bands to never shoot the new ones at my sisters because the old ones stick better.
That's right. True.
So
I had a patient come in one day who was talking, she came in laughing. And I asked her what she's laughing about. She says she's been laughing since that morning when she opened her mouth and a rubber band flew out and stuck to the back of her teacher's hair. And it stayed there all day long. And all the kids all day long were laughing.
That's amazing. And you know, as a kid, you're not telling the teacher at all. So let's see. We sort of briefly touched on this. Well, not briefly, we kind of went in depth. Other than a more attractive smile, why is it important to put the teeth in the correct position?
Because they look, not only do they look better, but they work better. If the occlusion has been corrected, if everything's fitting the way it's supposed to fit and functioning the way it's supposed to fit. For example, your front teeth are supposed to move your back teeth apart when you function. If you have an overbite, that's not going to happen. You're going to get more wear of your back teeth. If your teeth fit and function better, they also look better. So our first criteria as to whether a patient needs treatment or not is function. It's function, aesthetics, stability, in that order.
And regarding stability, retainers.
Yes.
As you've always told me, teeth have memory. So when a patient goes into their retainers afterwards, how long do you expect them to need to wear the retainers?
Only as long as they would like the teeth to remain straight.
If it were simpler than that, you know, it'd be nice to say, oh, for a year or two.
Yeah,
it's just true. Teeth do relapse, and it's sad that, you know, someone can finish ortho, and if they don't wear the retainers starting day one, things will start moving back.
You have, as an adult, a whole new skeleton every 7 to 8 years. All the bones in your body change over, including the bones that support your teeth. So what we ask our patients to do is to wear retainers full-time for a year. And there are physiological reasons for that 1 year time slot. And then we switch them over to wearing the retainers at night when they sleep. And I like them to wear the retainers at night when they sleep forever.
Well, I'm still wearing mine.
Pardon me?
I'm still wearing mine.
All right. Anytime you need an adjustment, let me know. I know a
Thank
good
you very
orthodontist.
much. The first retainer you made for me, I remember, was neon blue and it had a soccer ball right in the middle of
Yep.
that. So
Yeah, we're still doing that.
yeah, it's, and they're fun to look at. You're hopefully gonna be more likely to wear them.
Yep.
So is there any aspect of orthodontics that you are particularly passionate about?
Yeah, as I've alluded to, it's the growth and development, the guiding a patient. I would rather guide a child's development than have to fix something that's broken. And that's been one of my joys in life, to be able to look at a 7-year-old and maybe do a little tweaking at 7, so that when they're 11 or 12 and wear braces, they're on braces less time and with a less complex treatment plan,
Right.
and then follow them onward from there. I'm fortunate enough to be at a point now where I'm treating grandchildren of patients.
That's amazing.
It is.
And that is really one of the joys of being in dentistry in general, is to be able to treat generations.
True.
Yeah. The old adage, an ounce of prevention is worth a pound in cure.
Mm-hmm.
And that's what we want. We don't want to have to do much. We want to be able to have boring types of patients where things go well. So it makes our day when we can see people are taking our advice. And I know as an orthodontist, you'd say the same thing. You want things to go seamlessly, because anything else is a headache for not just the patient, but for you too.
And for every patient that comes in after them during that day, because if a patient comes in with a problem, it throws the schedule off.
Right.
It throws the schedule off. Everybody's treatment gets affected. I want things to flow very smoothly, very evenly, very easily. I want the patient to come in and do whatever adjustment we have to do and send them on their way with a smile.
Right.
I want them to smile all the way through treatment, not just after treatment.
Amen to that. So is there an age limit for orthodontics?
The oldest patient that I treated was 83. She needed some prosthetics, and her restorative dentist asked if I could create a better platform on which to do restorative treatment. So she was in limited appliances for about 6 months, and he was able to do the 4-unit bridge that he wanted to do with much more ease. He didn't have to do endodontic treatment on the abutments. It all worked out well.
If you're doing comprehensive dentistry to get the best results, the mindset, at least since I've been studying, it's changed to really focus on the importance of using your orthodontist as part of that treatment outcome. So if I know for 8 out of 10 times, if I have a complex situation, you can make a complex situation much easier by adding the orthodontist into the treatment plan.
My cousin, Bruce Singer, may he rest in peace, was the one that taught me that. Create the best possible platform on which to do restorative treatment. And the dentists that I've had the pleasure of working with over the years that understand that have all told me that it has made their lives much simpler and made their patients' restorations that much more long lasting.
Right. Because even if you're doing veneers to change things cosmetically, if the teeth are in a proper position, that means the dentist has to reduce less of the tooth structure.
Exactly.
Which means a better bond, which means longer lasting veneers. So even if you think veneers can do it on its own, that doesn't mean that that's going to be the best result for the patients, and definitely fewer headaches for the dentist too. So I'm going to end with one kind of odd question.
All right.
What is your favorite tooth and why?
What is my favorite tooth and why? My favorite tooth is the mandibular right first permanent molar. And the reason why is when I was in dental school and gold was $32 a pennyweight, which is nothing compared to what the price of gold is today. I made for my fiance, who's now my wife of 54 years, a mandibular right first permanent molar, the entire tooth, solid gold, soldered a gold ring on it and put it on a chain and gave it to her.
That's amazing. And what a wonderful wife you have too, and who makes the best cookies. Also, every year we're the recipients of the most creative dental themed cookies too. And you'll find a lot of dentists, probably fewer nowadays because there's less casting, but who became jewelers. That was sort of their side project, but that's amazing. So I want to thank you, Dr. Malerman, for taking the time to go over some orthodontics to help the general public understand some complex issues in a more basic way. And on a personal note, I want to thank you because I know that I wouldn't be in the position I'm in now as a general dentist because you inspired me early on in my career. You wrote a letter of recommendation for me. I got to shadow you early on, and I am just so very appreciative of the role you've had in my life. And I know that many people can say the same thing about you. So thank you for being such an inspirational person in my life and many others.
It's been a reciprocal relationship. Thank you.
Well, that makes me feel pretty good too. So how can we find you in practice or online?
You can reach me at Fort Washington Ortho, FW Ortho, at admpc.com, or at orthodontist for you, orthodontist, the number 4, the letter U, at gmail.com, or send me an email. You can reach me at Molerman, MOLARMAN, at Dr. Malerman, DRMALERMAN.com. I will return the email.
Thank you so much for taking the time, and hopefully you get your inbox flooded with questions.
Always happy to talk about dentistry. It's my second favorite thing to talk about.
And the first?
My family.
I knew that would be the case. Thanks again, Dr. Malerman. I really appreciate it.
Thank you, Dr. Limberakis.